Age Tech Innovators.
Hello, and welcome to Age Tech Innovators, the podcast where we explore how technology is transforming the way that we care for our vulnerable population. I'm Monty, your host, and each week we chat with inspiring leaders who are making a real difference in the lives of vulnerable people, sharing innovations and ideas that help support those and uplift those who need it most. Join us as we work together to build a brighter, more caring future for everyone involved. Now, let's dive in. So, I have the absolute pleasure to be talking to Surendra today. Surendra, run me through who you are and what you do in 60 seconds.
Thank you, Monty. Thank you for this inviting me to this session. I'm Surendra, and I've been working in health tech for the last 18 years. Worked at Cisco for about 11 years, essentially driving healthcare technologies. And then the last 7 years, I've been a co-founder in a remote patient monitoring solution to manage chronic patients out there.
Amazing. So, you've been in the industry for a while. What brought you into the industry? What's your personal journey of how you actually entered this health tech space?
It's interesting. I think, I go back several years, 1984. 84, my father was 58, a chronic patient in India. I mean, he used to work in a small town and he was diabetic and he had a cardiac condition. Long story short, he had a stroke, poorly managed. I see that even today, chronic patients all over the world. I've engaged with the healthcare systems practically in most parts of the geographies in the world out there, and I've noticed that chronic patients are very poorly managed at any point of time out there. So he had a stroke, and basically, the physician who was supposed to take care of him, was not very experienced. My father passed away at the age of 58. Okay, a chronic patient. That set me thinking at that point in time, but 1984 was too early right now for technology to actually assist, let's say, unqualified or poorly qualified physicians in remote parts of the world, or manage patients at in areas or which are basically underserved. But when I joined Cisco, that was the time when it basically flashed out there, the technology that Cisco had in relationship to telehealth that was essentially emerging out there. I suddenly discovered that this was probably the best place to actually, this is a great technology, a tool that should help, a lot of the patients in underserved communities, chronic patients, really manage their conditions out there. So I joined that particular team and I joined the group out there to essentially see how we could leverage some of the innovative technologies from Cisco to assist with our customers all over the world out there. That's what got me into healthcare, and that journey continues.
Thank you so much for sharing. It's a very personal story, and it's really great to hear that you entered in to actually make a change with off the back of that. When you mentioned you've had experience in different territories. I'm really curious to hear how you see that chronic patient or chronic care is managed, the differences or the similarities between potentially India, the US, and other territories that you're familiar with.
Yeah, so I think I can start with my just the US itself. I'm a chronic patient myself. I'm diabetic. I have, I use the Libre continuous glucose monitoring solution out here, and my data goes and reaches my physician system. And I'm part of the Stanford healthcare system, one of the best in the world out there. But my specialist, even though they have access to my solution, okay, the only engagement that really happens is either episodic, or if I have my periodic 3 month or 6 month consult out there. Okay, and during the consult, it's when she actually examines the data and said, oh, you've been having so many alerts in the past out there, blah blah blah. And that's the time when we really talk about titrating the medications. Okay, now, I've seen this. I know I worked with another customer of ours, again, one of the largest customers in California, and they use the same solutions that we have out here, patient generated data. They used our solution, But what they've really done is a very intelligent interface, AI/ML interface out there, where the solution looks at basically the patient generated data, the EMR data, and it looks also at the lab data for a particular patient, cardiac patients out there. And they can actually do what is called as guidance-driven medicine therapy. So based on real-time data that they're receiving from the patients out there, the system spits out, a recommendation that really says, I mean, I think it's about time we change the medication for this particular patient. Okay, and either the dosage or even change a different medication out there. So this is more proactive care, and this is what actually I think is what is really needed in the healthcare domain, especially for chronic patients, that you move away from the whole episodic nature that, only if I have a palpitation and I end up in the ER, you can't say, you look at me, you look at my vitals and say, okay, now I got to change your medication. This is happening in real time. And this is essentially the change that is actually needed in the healthcare system out there.
So,
I've seen this in other parts of the world also. It's all episodic everywhere. Patient has to walk into the door with a condition or a situation before they actually get any care. So very reactive.
so the use of the phrase proactive is, at least in my experience in the States and 100% in Europe, is something that it's been discussed for years, and yet it still hasn't been, from what I've seen, adopted at scale. What do you think some of the bigger challenges are facing scaling proactive support?
Yeah, I think I worked on this on this issue for a long time. A long time. I saw this for the first time. So in the US, when the Accountable Care Act came, one of my largest customers at Cisco, they actually implemented a solution for managing patients at home. They put a bunch of nurses in front of a computer. Okay, they had a nurse practitioner overseeing whatever work these nurses were doing, and then a physician over and above out there, right? So when I actually looked at that, I really realized that the biggest problem out here was scaling, was, as you had mentioned, scaling. You need a lot of nurses behind a desk because you're going to get alerts in real time and you need to be able to respond. The challenge is in most healthcare systems, they do not have a process. This process of managing patients is extremely complex in healthcare systems because it requires a lot of nurses, and there's a shortage of nurses out there. It requires a lot of nurses. It also requires a different protocol of being able to essentially understand the signals that are really coming from a patient and to be able to respond in real time. And we've seen this as a solution provider for remote patient monitoring. I've seen both success, indifference, and failure at a lot of healthcare facilities, largely because the operational processes, the most complex part of this whole equation is basically operational process and people. They don't have adequate staffing of nurses, and they can't get those staffing out there, and then they have a lack of process. Reimbursement comes much later, whether you get paid for remote patient care, remote patient monitoring. That's a secondary issue out there.
That's really interesting. And so, if one of the largest challenges is process, then what would you recommend to businesses looking who say, I have preventative, I have proactive, who are potentially tech heavy, but not process design, change management? I mean, what would you say to these people if this is one of the biggest challenges?
I think again technology will come into play out here. I'm actually seeing some of the systems out here looking at the large language models out there, agents creating what are called as virtual nurses. And this is what you really need in the technology domain. That you need an army of, let's say, frontline workers, nurses typically, who are engaging with patients regularly, reminding them that they need to take their vitals if they haven't taken their vitals, having a discussion with the patient based on some of the observations out there, and then creating what is called as an interaction or basically an escalation model that says patient X or patient Y or patient Z needs an escalation out here. And this will come through a variety of mechanisms out here. You've got, for example, home health agencies. So even before, let's say, the healthcare system actually responds to the patients out there, you could have the home health agency go and start responding in real time because they do patient care at home out there. So you do have the infrastructure that really exists. The mechanism of engagement basically changes. You now have the ability to create, a whole army of virtual nurses out there who can then look at those millions of chronic patients that are there, and tap that whole issue of the engagement model, being able to engage with the patients. That's the first primary step out there, being able to basically interact and engage with the patients on a regular basis, understand the data that is coming, separate the signal from the noise in that particular data out there, and then being able to alert, let's say, the adequate response from a system out there. Okay, whether it's to bring a patient into the facility or being able to get through via telehealth or some other mechanism for the physician or a nurse practitioner to basically engage, interact with the patient at high level. I think that's the mechanism that probably will, I will see that. I mean, I should see that playing out in the future out there in healthcare.
Including that, where else or what other large opportunities do you see within this space in terms of innovation?
I think in terms of innovation, definitely the area of what is called as medicine therapy, dynamic medicine, guidance-driven medicine therapy. By and large, a lot of the cardiologists are busy or specialists are so busy that treatment of patients is really done more reactively. Being able to be proactive about medicine therapy, which is what is really needed. Being able to engage with the patient and change or titrate the medication at an appropriate instance. I think that's the second area where I will see a change out. And I know that a lot of this is easy for us as technologists to basically articulate in healthcare. They go in a very conservative fashion, do no harm out there. So it takes a long time for technology to settle down in that particular domain. But I see that really happening before we actually look at personalized medication and stuff like that, which I think is still far out to the future out there.
From a technology perspective, how do you think this is going to be delivered? Do you think we're going to see more hardware and wearables, or do you think we'll see more passive sensors? Where do you think the trajectory is heading?
I do see the hardware getting more sophisticated and more organs of the body being digitized. I look at my smart, my iWatch or, any device essentially becoming more and more sophisticated over a period of time, being able to track or digitize a lot more of my organs out here than they are doing right now. Okay, so whether it's blood pressure, whether it's heart rate, whether it's basically, which is very common sense. I mean, it happens out here right now. Okay, whether it's to be able to sense stress. Okay, and since the phone is actually now an integral part of a human system out here, okay, a smartphone. Okay, I do see that there are a lot more signals available in a smartphone that one can really tie down to the data that is being generated by patients. But I see this is where, see, the challenge that I saw today in remote patient monitoring is you give a patient, 3 or 4 devices, one for measuring heart rate, one for measuring, let's say, blood pressure, one for measuring blood sugar. The more devices you give, patients get overwhelmed. And there is a bigger failure at that point of time or non-compliance from a patient's perspective in being able to be very proactive in taking their measurements out here. But if you have a non-intrusive system like like your watch on your body out there, right, it's catching all the signals in real time and transmitting it, and you may not have the same degree of accuracy as a lab generated device, but at least it is providing you an adequate amount of information that allows you to actually engage with the patient. I see that becoming the center of most engagement models. I see them a lot more sophistication and a lot more body organs being digitized, the human body being digitized in real time.
In terms of digitizing aspects of the human condition, so it's either our behaviors or our body. I had a guest on not too long ago who was digitizing tracking coughs using passive microphone in your phone. What do you find most exciting or interesting in terms of digitizing the body or the behaviors around the body?
If you look at the prevalence of the most common conditions, it's mostly cardiac, it's COPD, and it's basically diabetes, right? These are the big, and of course there are others like cancer and stuff like that. Where there is adequate care and treatment, I mean, those are far more serious chronic conditions that are being taken care of in a very different fashion out there. But the ones where there's a lots of cost going into the system are the cardiac conditions, the asthma, COPD, diabetes out here. Okay, I would see that this basically these these are taken care of. And tied to that, of course, are situations like stress. I mean, these conditions are only all driven or escalated through secondary conditions like stress and other factors out there. So being able to tap into those and really getting a much more holistic picture of a patient's condition out there, and a little more refined signal that really tells that the patient is decompensating in real time. Being able to catch that, that's where I see a lot of the innovation. I feel excited that if we can actually be a little more proactive out there, that's where I see things to be something that will catch my interest out here.
Do you ever think about, because I know that you're a founder, do you ever think about founding something else in this space?
Yeah, I'm trying to basically see how technology is pacing out here, certainly. I mean, at the end of the day, everybody loves to basically reach a stage where we look at, let's say, guidance driven, go beyond guidance driven medicine therapy, but look at personalized medication. I don't see that happening in my lifetime. Okay, because the omic data that you really associated with personalized medication is so large, and the systems are actually not very mature or not mature enough to be able to basically reach that particular stage out there. But I see that happening at some point of time, and I hope I may not live to see that, but I do hope that my successors actually reach that particular stage where the interventions are really not surgical, but a little more proactive, and we can actually, medication, for example, I know that medication is an approximate science at this point of time. It works for some, it doesn't work for others, it works for this thing. Okay. So being able to say that, hey, I can give you a medication that really works for your biological system out there, I think that is where I would look at as an end result.
I was having a conversation with a really smart guy. I won't name drop him now, but he's been on the podcast, and he was talking about a similar thing, which is looking at our genetic makeup and then tailoring medicine to our actual specific genetics. And that is something that is going to be crazy and isn't, as you say, isn't mature to the extent that it needs to be for it to be scalable or accessible.
Absolutely.
So I've got a bit of a random question. And this is, you mentioned that hopefully in your lifetime you'll see this happening, but at the same time there's a lot of data that needs to be collected. If we suddenly spun the clocks forward 30 years, 40 years, and you look in the mirror and you're suddenly an elderly man, maybe 50 years, you look in the mirror, you're suddenly an elderly man, you've got a grey hair and you're feeling a little bit wrinkly. What would you like technology-wise for you? What would you like to use on a day-to-day basis to stay
So
independent as you are nearing the end of your life?
I was involved with a very interesting project once in Florida out there, and they were really automating the home. Okay, complete automation of the home. Okay, and the way they were really doing this, and of course that technology exists today. It doesn't need to be futuristic. Okay, but the premise was very simple. As an individual today, I have I have at my fingertips a complete control of my financial system. Okay. I know how my stocks are doing. I know how my bonds are doing. I know how my cash in the bank is performing for me, et cetera, et cetera, et cetera. So I have a very good perspective and technology and tools available to really look at my financial system. But I have nothing out here which actually looks at my health system. okay, as an individual out here, right, at any point of time. And so what they did was that they really automated the home. They said, this is technology has to be non-intrusive in that particular perspective. It should not be visible to you. So, for example, they had the tiles in the bathroom. If you just stood out there, it took your weight. There was a magic mirror which actually saw your temperature, which actually saw your heart rate, which actually saw your vitals out there. It just captured it as you're looking into the mirror out here in your bathroom on the right. And they had basically plastered the home with technology, similar technologies, and said, the future home out there. And they would basically create a dashboard. They created the dashboard where at any point of time, it was really plotting your health in real time
Pretty cool.
and giving you a complete visibility on your health, on the quality of your health at any point of time out there. And that I thought was something which I see, 30, 40, or 50 years of time out there, that I would have everything available, because my devices, my monitoring devices would be monitoring most of my organs out there. And just like my stock portfolio is tracked on my stock systems out there, my health is basically tracked in real time, and I have real time visibility into what's really happening into my whole body out here. That's what I would actually love to see, and that's what I would see 30 or 40 years from now. I mean,
So cool. It'd be so nice to see heart health, brain health. Really interested in how brain health is, memory,
hmm
processing speed. Much like on a computer, you have all your RAM and your memory. I'd like
yeah.
to see that with our brains. That's really interesting. Because then you can start to, off the back of what you measure, you can start to improve it, and then you can start to figure out
hmm
what to focus on and what will have the biggest impact in terms of your longevity, quality of life. I like that. It's a different answer. One of my someone on this podcast came on before and said that they want to have a robotic legs so they can go to the pub with their friends. So it's a very big spectrum. I really appreciate that. And so we've chatted mainly about the US. But you mentioned at the start of this conversation that you have had experience in different territories. I'm really curious, I'm sure the people who'll be listening are really curious about what some of the interesting insights which maybe stand out to you in terms of how healthcare is managed in, I think, did you mention India is another example that you've had experience with?
I've worked with facilities in Canada, in Mexico, in India. I've done in Australia. I've done in Italy. I've done in Qatar in the Middle East. So engagements, in different geographies out there on the world.
Okay, so make the question a little bit more specific because it's such a huge topic. One of the biggest issues I see in the UK for adoption of telehealth and remote patient monitoring is the funding structure.
Mm.
And insurance isn't tied into the benefit that the technology brings. So if I use a device and it saves me X amount of money on my insurance, there's no benefit that they get that I get that I don't get paid. There's no compensation. None of the suppliers get compensation, which means that there's a really slow rate of innovation in the UK compared to the US. How are some of the funding structures different across between, I mean, you said India, you've seen Canada, you've seen Mexico, how do you see funding structures improving or challenging the rate of tech adoption?
So I think, at least in the US, I did see after the Accountable Care Act, the moving away from fee for service to fee for performance or fee for value out there. Okay, was essentially started to drive, and over a period of time out here, there was also reimbursement for remote patient monitoring. Okay, so there is in the US at least there is, if you have remote patient monitoring, you do get reimbursed. Now, obviously, the challenge, of course, as I said earlier, in the US is essentially more process and people. Okay, there are not enough nurses available out there, and the processes are not really set up for home care or home this thing out there. So the pickup has really been slow. Okay, at the end of the day, I think economics really drives the market. Okay, in the healthcare system out there. Okay, the realization at the end of the day, and this is, I think, where the transition that I see taking place is when insurance really sees that outcomes are dramatically improving with the adoption of technology, and that's when change starts taking place. And I think everybody waits to see the proof. Okay. that is it really happening, or is it just another cost burden on the system? When it becomes capitated, when the reimbursement becomes capitated out there, where, for example, if insurance out here, we've got Medicare Advantage in the US, where you get a certain amount of money to manage a panel of patients out there, and you have to manage that panel within that particular, money in that domain. Then, at that point of time, you really start looking at where your cost structures are. Who are your most expensive patients out there? Pool. Okay. And is there a mechanism by which you can start characterizing these patients, being able to identify in advance that these are the patients that are getting into that particular pool, and then saying that, okay, these are the patients that need a very different mechanism for management, because you really got to contain the costs for these patients out there. Okay. I mean, it's the same 20/80 rule, right? The 20% of the patients really drive 80% of the costs in that particular system out there. And the challenge is that, uh, you know, even though insurance are very smart at actuarial services out there, their ability to really understand the census of patients out there and to see proactively, or I always go to the proactive, which of the patients are decompensating and falling in that 20% category that are going to take 80% of the cost. That's the segregation that insurance really has to do, and create a mechanism that enforces the adoption of technologies and creates a compensation structure for even the providers to say that you have to manage these patients leveraging, whatever the tools and technologies that exist out there. That's how I see it playing out over a period of time. That doesn't exist for a large part, but I think it's basically beginning to settle in.
I'm conscious of, there's a second part to the question which you're about to answer, but before you answer that, I just want to throw in one extra seed of question. Which countries of the ones that you've had experience in would you say is closest to this optimized funding, saving money, being reimbursed?
I think the US is basically moving in that direction very slowly, but they are moving in that direction. I have seen, for example, some of my peers out here, the insurance, actually looking at, for example, and I know in some markets out here, where they're really looking at some of the facilities and hospital systems and saying, okay, I'm going to basically reimburse you extra for managing patients virtual care and stuff like that. So I'm seeing that happening out here in the US. In other parts of the world, I mean, in UK, you've got your national health system, NHS out there. I had only one engagement many, many, many years back that really never panned off. Okay, in this particular direction for whatever reasons, thing. I've looked at the Middle East. I think I was actually seeing, and they have the advantage that they throw a lot of money at everything out there, and they basically build, five-star facilities. And I'm hoping that they will basically provide five-star care also to all of their patients. But I've seen that happening at least in the Middle East out there, because they don't have a shortage of money. They never had at that point of time. Now that might change over a period of time, but they never had a shortage of money, so they could throw a lot of money at this particular process out here. I see a lot of indifference in other geographies, because most of them are still work on I mean, they don't even have a very mature payer insurance system out there. When I look at Mexico or Southern America out here, it's basically largely patients pay for the care to a large extent. Of course, there are areas out there where insurance really factors in out there. But there is a lot of indifference, at least as I see. I tried to work with a customer in Chile, but that has this thing. I've also tried to work with a customer in Guyana. Okay, but that never actually took off. Even though I engaged, in Guyana, I engaged right to the Prime Minister's office, and I had the, privilege of actually demonstrating my technology and my solution in an Amazonian village, which he said, if your technology works in the village from an Amazon jungle, then I'm basically willing to consider it. But then, I mean, bureaucracy really plays a huge role in in making sure that it takes a long time for technology to settle in any of those domains out there. Canada, I see Canada also moving in that particular direction. I think they're doing a lot of work in telehealth in that particular domain out there. There's a lot of work in Canada Canada's done a pretty good job as far as telehealth and virtual care is concerned. I really didn't see much in Australia, but then I didn't have too much of an engagement with Australian systems out there. That's where I mean, I've seen in Italy, I did see a little bit of working with a customer who was actually looking at managing, cancer patients that actually live in tier 3 cities, because, and then being able to remotely manage some of those patients out there. But again, I think the pickup tends to be a little slow. Of course, after COVID, I think a lot of things changed all over the world.
I appreciate the overview, and I feel like off the record we could always have a conversation here about your adventures in the Amazon. So I can't believe we've already been 34 minutes. And so my last question before we wrap things up is for people who are listening, be it people who already work in the sector or people entering into university or leaving university who have a desire to bring innovations, be it how we track our organs or how we can introduce proactive services. What advice would you give to budding founders, to aspiring entrepreneurs thinking about entering this space?
Yeah, I think so. One of the things that the note of caution that I would actually give to budding entrepreneurs in this particular space is be prepared for pace. Pace is slow. Okay. Uptake in healthcare is never going to be fast enough. Okay. So if you have the wherewithal and the instinct to go for the long haul, you're going to see a lot of success. Success, definitely you're going to see, but it's not going to come instantaneously as it comes in other domains out there. Okay. It'll take its time. Okay. So you should have patience. That's one thing that I would actually caution. It's a very enriching field. So it's basically when I actually go out and I see how patients react and how healthcare systems react to the situations that technology enables, it's very satisfying. So it's extremely satisfying. When it gets adopted in an extremely large scale. The scaling is very, very fast. So there is definitely a lot of money to be made from a technology or this thing entrepreneurial perspective out there. That would be my advocacy to anyone who is trying to enter into a technology in the healthcare space. And it's largely because there's regulations. If you have a technology that requires FDA approval, there's a cycle that you have to go through before it basically this thing gets adopted, and then it's got its own scaling factors out there. So I mean, it's personally enriching, it's personally rewarding, but be prepared. It's not something that'll, and you're lucky, some technologies shoot off instantaneously out there, but by and large it's going to be a slow uptake. Okay. In this particular domain, that's what I would actually look from an entrepreneur's perspective.
Honest and yet motivating. Appreciate it. Well, Surendra, it's been a pleasure. Really, thank you so much for some of your really niche and specific answers. I know the people who are listening are very much in the space, so they'll really be appreciative. And thank you so much for your time, and really appreciate it.
Thank you, Bonnie. Thank you. Pleasure to be here, and very happy to talk to you. And thank you again. Thank you to your listeners who may be listening to this conversation. I hope
Amazing.
we get a few more technologies and a few more entrepreneurs, in this space.
If we get one entrepreneur, I'm looking at you, whoever is watching this right now, get one entrepreneur from this conversation, then it's always worth it.
Thank you.
Amazing. Thanks very much. Peace.
Yeah.
Bye bye bye.